most of what I'm going to say today really comes out of my experience at Ascension Health, and then to some extent working at Aquinas in the Master of Arts in Healthcare Mission program. When Ascension hired me, the first thing they asked me to do, I was vice president for theological education, but my role was really to set up a board formation program for the system, which they didn't really have at that point. They had some elements of board formation, but they hadn't really gotten it systematized. So I really had very little idea what I was doing when I went into it. I had done a lot of formation work, but doing it for boards was another thing. So I learned a lot from beginning to end, and much of what I'm going to say to you today is kind of the way that I did that. And even though my experience was mostly focused on board formation, I think all of these apply to different levels of formation within Catholic healthcare. You know, we, like this system, also did things for physicians, we did things for senior leaders, we did things for middle management in formation, and it was all pretty much the same process, but at different levels and addressing different ways in which leadership was exercised within Catholic healthcare. How many of you, I know you're all in the Masters in Bioethics program, how many of you are mission leaders? Okay, we've got one. What are some of your other positions? Instructor, ethics, research administration, healthcare consulting. Okay, that gives me an idea. We've got a range of backgrounds here, so we maybe through discussion can kind of try to explore some of the implications of this. But whatever your role is, if you're in Catholic healthcare, it seems to me that you would want to think about what your own vocation or spirituality has to do with your work. I think that's really the starting point of whatever kind of formation program we're doing. Because I think that if we're in faith-based healthcare, and Catholic healthcare in particular, one of the things that distinguishes it is that it comes out of a faith tradition and should reflect that. Now, this was always you know, an issue working with the boards, and I guess with all of our leadership groups, because there was a fear that formation meant we were trying to make everybody into miniature Catholics or something. That was not the purpose of it, you know. So I always started out with groups by telling them that the purpose was not evangelization or proselytizing. The purpose of formation was simply to help leaders at different levels to get in touch with their own spiritual selves or their spiritual awareness, which would be an asset to the organization in addition to being a benefit to them personally. And in the time that I did this, I generally found that was true. It sometimes took us a while to get to that point, but I think most of the participants really experienced that happening, that they saw it as a benefit for themselves, and it enabled them to do their jobs better, because they could really enter into the ministry in a more wholehearted way. I suppose, you know, one of the basic questions then, aside from that very general introduction, is why do we do formation? No, partly because of that, personal benefit and also the benefit to the organization, which is a mission-based organization coming out of a particular faith and spiritual tradition. But when we look at it in the bigger picture here, Bill Cox, who wrote this article quite a few years ago now, says that this is another reason why we would do formation, because of these troubling questions about whether Catholic healthcare can remain vibrant given the multiple challenges that it faces. And he says the facilities may not close, but over time they may lose their religious character. And that's the most direct challenge that we face. You know, we could remain very successful, effective deliverers of health care, but lose our religious character. And I think the reason we do formation programs is because we don't want to lose that. At a basic level, you could say it's a market advantage. Steve and I were just talking about that a little bit earlier, that most people still recognize Catholic hospitals as having something that they want in terms of the quality of care. But we hope that it's more than that, that there's also a deep realization, for example, of the sacramental nature of ministry. And I can talk a little bit more about that later if you want to pursue that. This is from I think this is from Scott Appleby, who's at the University of Notre Dame, or else it's Bill Cox, one of the two. But he goes on to explain here some of those stresses and questions that are posed. You know, mission strain of collaborative ventures and public funding. I have a friend who was a CEO of a Catholic hospital for many years. He's now retired, but he still maintains that public funding at the level that we receive it now and Catholic mission are incompatible. He says bluntly, once the government gets in, the church gets out. Now, I don't agree with that, but I certainly recognize the challenge that he faces. You know, if you look at your budgets and realize how much of your revenue comes from government sources, and they want to pay back somewhere along the line, you know, so we are beholden to them. Necessary professionalism, which need not, but sometimes does militate against mission and religious character. Commodification and lack of theological formation. This is a huge problem, and I would tell the board that I worked with that what we were trying to do is make them theologically fluent. They didn't all have to be theologians, but they did have to know enough theology to be able to talk about the issues they faced in theological terms. So one of the things I did was make flashcards for them, which we call them flashcards, but there are about 20 theological terms that I thought board members need to have a basic familiarity with. Just the word ministry itself, for example. Very complicated theological question in the Catholic Church today. And yet if you ask most board members to define ministry, they probably think it had something to do with the local parish. Well, clearly it has something to do with it, but that's not what we're talking about when we deal with organizational ministries like healthcare. So a certain amount of theological fluency to be able to talk about the ministry of healthcare in theological as well as financial, as well as strategic, as well as operational terms. Effective boards really need to be able to do all of those things, to address the issues in all of those ways. This is from Scott Appleby here, where he talks about American culture generally, and I'll let you read that for yourself. Kind of an understatement, I guess. But again, on a cultural level, even though we don't want to get into a kind of despising of culture, we live in a culture that's saturated with values and goods which are not necessarily, and often are not, consistent with our own faith or spirituality. And part of the process of formation is helping us to become more aware of what those cultural forces are so that we can live in that world and still be effective as a witness and as a presence in it. Because we're not in the business of just accepting everything at face value if we want to make a difference. So I would tell boards, and again, this applied to all of our formation programs in general, but first of all, I'd emphasize with the boards that we require formation because ministry governance is different. You know, a lot of our board members who came in had other experiences on boards, and there were many things that they would do as a board member in a Catholic hospital which were the same as they would do at General Motors or Boeing or the local bank or wherever. There are certain fiduciary responsibilities that boards have that are the same in every organization. But a hospital, and a Catholic hospital, is obviously different in many ways from Boeing or from the local bank or whatever corporation you're talking about. So there's a fundamental difference which adds a layer on to governance responsibility. You know, you can't come in and be effective in Catholic hospital governance without an awareness and an understanding of that added level, which we would call mission. I also always tried to make it clear that board formation was different from board development, which is, again, is something that every board needs to do. You know, they hone their skills so that they can function better. Formation was more an internal reality. You know, it wasn't just learning skills of governance, it was really cultivating an interior life that made you a better board member for a ministry. Formation focuses more on who we are than on what we do. You know, what you do as a board member is important, but we are also looking for a certain quality of person in order to lead this ministry in a governance role. And I think there's big implications here, both in recruiting board members and in hiring leaders for healthcare. Sometimes we call it mission fit, you know, or hiring for mission. But I think we need to learn to be more explicit about asking potential employees and prospective board members whether this fits. Are you the right person to function in this role? You don't have to be Catholic, you don't have to be Christian, but there are certain things that we need to expect of you if you're going to be on this board. And when I left Ascension, we were just getting into the beginning of trying to incorporate that into board recruitment materials, to be more explicit about the faith or the spirituality commitment that's required for this. I remember when I was starting, I asked our CEO, you know, I said, well, what if I go out to a hospital to do board formation, and we've got a board member who says, you know, I'm not really interested in this formation stuff. I wanted to just join the board here. And he says, well, he said, I think they'd probably have to find another board. And I didn't expect that clear an answer, but it was a real mandate for me in terms of saying how important this was, you know, that we really needed to ask the question, you know, are you prepared to enter into a formation process which will help develop you spiritually to be a better board member? If they say no, well, then, you know, probably they do need to find a different board. Formation, as I mentioned earlier, is rooted in the conviction that everyone has a spirituality or a spiritual awareness. As I said, you don't have to be Catholic or even Christian, but it's based on the assumption that there is a spiritual dimension to life which is part of who we are as human beings. At least in the Catholic understanding of the person, that's fundamental. And this is based on that, you know, that we're developing board members or forming them given the fact that we believe they have a spiritual dimension and a spiritual awareness, and that's the real focus of formation. There was a column in the paper just this morning by David Brooks about scientific research and, you know, scientists who try to explain everything in terms of neurons, you know, and they don't, you know, there's no spirituality, it's all explained chemically. And he had a name for it. Did anyone read that? Maybe but-if-isms or something like that, but if, you know, we could explain it some other way. Well, anyway, our view of this is not that everything can be explained mechanically or through science, that there is a dimension of the person which involves some mystery and a spiritual aspect, and that's what we're trying to get at in formation. Pardon me?
Beyond the brain.
Beyond the brain. What does he call that thing in there? There's a couple paragraphs down. He says the but something or others.
Hold on, I'm on Loyola time here.
Well, you get to read that little paragraph.
Third paragraph says this is happening at 2 levels. At the lowbrow level, the neuromappers, is that it or farther down?
Might be farther. You'll recognize it when you see it there, but it's kind of this exact thing, which is prevalent. You know, a lot of people believe that. I remember one day I was on a flight, and this, what does he call it?
Nothing butists.
Oh yeah, nothing butists. And how does he explain that?
All right, at the highbrow end, there are scholars and theorists that some have called the nothing butists. Human beings are nothing but neurons, they assert. Once we understand the brain well enough, we will be able to understand behavior. We will see the chain of physical causations that determine actions. We will see that many behaviors like addiction are nothing more than brain diseases. We will see that people don't really possess free will. Their actions are caused by material processes emerging directly out of nature. Neuroscience will replace psychology. Don't tell our latest med student who just matched there. And other fields as the way to understand action.
Okay, so that's what we're not talking about, that approach. We're basing it on this understanding and this assumption that there is a spiritual dimension which can't be reduced to scientific truth, and that's what we're trying to get at. And we see it as something that's essential to the future vitality of the Catholic healthcare ministry. And I really am convinced of that. If we don't develop this within our ministries, there won't be any Catholic healthcare in the future. It might be there in name, but it won't really make any difference. You know, it's essential not just to obey the ERDs, which I'm sure all of you are familiar with this at this point, but also to have persons who are aware of themselves as spiritual beings, you know, because that's part of what we do, a big part. This is just another way of talking about that. talking about people, you know, as the end of business and who they are rather than just what they do within the organization. And this is from the John A. Ryan Institute at the University of St. Thomas. This is from an article that was written some years ago in Health Progress. And again, it's another way of talking about why we do formation. And as you can read there, he says, the why of it is ultimately the transcendent purpose, the greater good of God's love, and God's healing presence. And when trustees or other leaders fail to understand this why, then lesser and more proximate goods will drive the engine of Catholic healthcare. So it's a question of establishing priorities here and saying, well, where do we really place our bets? You know, is it on this ultimate mission? You know, I always will say that if you look at the sisters who founded most of the Catholic healthcare systems in the country, that first sentence or two, that's why they did it. They didn't do it to be successful business people. They didn't do it to be strategists. They didn't do it to get a bigger market share. You know, the reason they did it was the transcendent purpose and the greater good of God's love and God's healing presence. Every single one of our founders would read that and say, well, yeah, I mean, even if she had never exactly thought about it in those terms, this was clearly why they got into this in the first place. It was that transcendent purpose and the greater good of God's love and God's healing presence. So from the lowliest housekeeper to the most exalted board CEO, everyone at some level has to have some understanding of this and be willing to explore that and to ask, okay, how can I buy into this motivation or this purpose of Catholic healthcare? Everything else is secondary to that. Even all the conclusions of moral theology, which are very dear to my heart, as a moral theologian, they are all secondary to this. So we developed a definition of formation. I'm sorry that this isn't more readable here. I hope you can make that out. But we talked about formation, first of all, as a transformative process. In other words, we didn't want formation to just look like another how to do it seminar. You know, this was really something which was intended to change people from the inside. And it was rooted in theology and spirituality. You know, partly out of the Catholic tradition, but then also a broader understanding of spirituality, and an understanding of those two things which connects us more deeply with God, creation, and others. And it really had three kind of major, sort of mega means of achieving this. One of them was self-reflection, which opens us to God's action. Secondly, deriving meaning from the work we do. And third, awareness of our own gifts, the ability to see our work as a vocation, and the ability to build a communal commitment to the ministry of healthcare. Again, I think that communal commitment is really essential because the founders of these healthcare systems did it out of the context of a community life. Virtually all of them did. And it doesn't mean that you all have to go off and join the convent. You'll be happy to hear. But in healthcare, as a ministry, I think it's essential for us to find a way to establish a kind of community which may not exist in other kinds of business. You know, an awareness of our togetherness and our cooperation, our willingness to leave behind part of our own personal agenda for the sake of this ministry. Steve and I were just talking about this before lunch in terms of someone who might leave a ministerial, you know, healthcare ministry commitment for something else just because there's more money. Well, sometimes we need to do that, but there's also a real important question about what am I committed to here, and do I have any commitment to the people who are in this with me in terms of my role in healthcare? You know, building a governance community, building a leadership community, which is more than just working together. You know, not living in the convent together, but someplace in between that. Because we, again, in the Catholic tradition, believe that much of our understanding of God flows from our life with other people. You know, there are instances in which God speaks directly and without mediation to us individually in mystical experience. It does happen. It's not the way most of us get to know God. Unfortunately, it'd be a lot easier if it were. We generally rely on human relationships to help us understand who God is and to carry out or to live the vocation that we have. The deriving meaning from it, you know, before I left Ascension, I had started to work a little bit with physician formation. And I remember one day I'd given a talk about it to a group of residents, and the resident director said, she says, "I know what you're doing." She says, "You're giving the why I became a doctor in the first place talk." You know, in other words, getting back to the original motivation that leads most people into healthcare. You know, there's an altruistic, spiritual dimension to it. Healthcare is a liminal profession in the sense that it lives on the boundary between death and life. I used to say to boards that until recently, investment bankers didn't realize that they were also a liminal profession. They came to discover that, however, after 2008. So it's a question of helping people discover the deeper dimension of what they're called to in their work as healthcare providers. You know, being explicit about the fact that I walk into an operating room, or as a nurse I walk into a patient room, and I'm encountering that line between life and death. You know, the most profound human mysteries. What does suffering mean? Is there a more basic question than that, you know, that we pose of God? And so it's grasping and embracing, giving people the ability to embrace that dimension of their work and not just pass it off as something that has nothing to do with clinical work or operations. When we talk about this, you know, the whole idea of formation has a lot to do with then discovering and nurturing a vocation, which is rooted in this deeper meaning and in this why question. And we could define vocation in a lot of different ways. I suppose the most basic way would be to say that vocation is a call to purpose. You know, kind of, why am I here? That any human being could ask that question. It's not a specifically religious one, but is there a purpose to my life? Vocation is an integrating principle. You know, what do I really organize the rest of my life around? You know, my call, what's the real thing that's at the core of me, and everything else has to fit around that. Vocation is a purposeful use of my gifts. If you're a religious person, you would often describe vocation as God's plan for me. What does God want me to be in the world? What does God want me to do? Or as Parker Palmer said, he's a Quaker spiritual writer, he said that a vocation is a place where your deep gladness meets the world's need. You know, that deep satisfaction that you get when you find out where you really belong. You know, some people leave their professions. I have a friend who went through medical school and got out into practice and discovered he hated patients. So he went back to school and got a doctorate in botany, and he's been perfectly happy ever since. Now, I wouldn't recommend that process of vocation testing, but it does happen. His deep gladness definitely did not meet the world's need in patient care, but I guess with trees it does, I don't know. But in any event, it's for most of us a question of trial and error. You know, you do run into people who have a crystal clear understanding of where they're supposed to be in life from a very early age. That's not true for most of us. It's got to keep getting sifted out and tested against various things. And a formation process, even though it's dealing with mature adults, should be a way of fine-tuning one's vocational awareness, you know, coming to a deeper understanding and appropriation of that.